My name is Amal Nirtakar. I'm the CEO of Patient Prism, and we're here with JoAn Majors in Patient Prism Studios this morning. And JoAn is an incredible speaker and author of several books in dentistry, and she talks about communication a lot in getting people and patients and team members to really do what they're supposed to do to optimize the journey of the patient. Obviously, as a patient, there's things that patients need, and there's things patients want. Motivation is a big deal. What's the way to figure that out, and how do you make something that they want into a need, or need into a want? What's your attitude on those patient wants versus needs?
That's a great question. Thanks for having me, Amal. I think that one of the things that for me is, I think that's something that we miss. My husband says regularly, every time I speak, I'll tell a story about my husband says, I'm not going to tip the chair back until I have a want, a need, or a desire. Because until he has that, it's really hard for him to connect and create value for whatever it is he finds.
Okay.
And this is a guy who's been practicing 37 years, so a lot's changed, right? I mean, he studied in St. Pete. He knows that the comprehensive exam is everything and doing all these things. But if somebody just wants you to look at this one and they're in pain, what we know today is you take care of me and what I want and my pain, then I'll trust you. Right. And so want to versus need to is really important today when there's so many different treatment modalities out there that are in fact want to. From implants to Invisalign to cosmetic or aesthetic dentistry, sleep apnea. There's a lot of types of dentistry that people want to have versus the need to. I've got this tooth bothering me, and can you take it out? Sure. And I think that for us, the languaging is different because if somebody in fact is calling us, at least on our practice, one of the reasons that Patient Prism resonates with me and I value what you guys do so much is because I believe so strongly with the soft skills on the front end that we create value for what happens on the back end. Back end, absolutely. In the Cycle 6, which is our case acceptance model, I talk about if we build this relationship here, the ball rolls downhill versus if I get all those details about your medical history, not that you don't get those, and the insurance and all those things that we used to think was first, the ball rolls uphill for the doctor. So this is his I want, need, or desire. If we, in fact, have somebody who's calling and asking those questions, there's a couple of different things that we do. I have a boutique DSO that I work with down in the Valley in Texas, and they have an orthodontist in their practice, but they're pediatric based, and so they wanted to grow more of their ortho. And I said, one of the things when you understand the want to versus need to is asking a couple of additional questions when it's about orthodontics, and saying, how far along in your research are you on orthodontics, or how far along in your research are you on implants, or whatever that might be, and waiting, because what I know is if they say, well, I've done no research at all, I've got to work really hard unless they were a great referral to create value because they're just beginning their search. The other thing that I know is if they say, well, I've looked at a lot of things and this is what I found, or again, if they say, I haven't done any research, I'll say, have you considered a budget? Because I know if they haven't done any research, they haven't considered a budget yet. Right. So if I can talk about money before they bring it up, again, it's that piece that I talk about, information versus excuse. I don't have to excuse away my fees for want to dentistry, but now I can actually give them information about why our fee is situated the way it is.
It's interesting. So you're kind of persuading them into a position where they come up with the solution that you are planning to give them anyway.
That's exactly right. I teach a technique that is probably one of my favorites that I created about 15 years ago, and it's called planned spontaneity. Okay. And so I use it in my audiences, I use it on the phone, I use it in a lot of different systems and that we teach. And planned spontaneity just means that I have some planned questions, and then my response is very spontaneous, but I know exactly what it is. So I've got the awareness of what I need, the information I need to give them, but unless I can get them, it's like a card game. It's like saying red or black, pick your color, and they say black, and I knew I wanted hearts. I say, okay, so I'll put black down, here's red. If they had said red, I say great, and I keep red. It's about leading them where I want them to be, and that's one of the things I think that, having been an early apprentice of the late Walter Haley's and working at boot camp for years, one of the things that I mastered was those questions. I mean, and my mother, having had a stroke and told she'd never walk, talk, write, or speak again, when she did learn to speak again in broken English, she was such an influencer. And the way she influenced was not because she used a lot of words. She knew the questions to ask, and she struggled for that question. and she would really reach. But she'd ask you that question, and you discovered where you needed to be.
And I think Albert Einstein was the first famous guy who said it's never about the answer, it's always about the question.
It is.
And if I can ask 99 smart questions, it outweighs one right answer.
That's exactly right.
And you're bringing really that philosophy into creating and distinguishing between need and a want. And I guess you want need, want, and desire in your husband's words. To kind of get the patient to move along the tracks. Obviously, we haven't talked about case acceptance here, and I think you will eventually in some of the segments. But it really is about that, right?
It really is.
Once you create that triad of need, want, and desire, the patient is going to come up with. They're going to accept it before you even present it.
That's exactly right, because you've allowed them to get there. And I think when you think about that, when we talk about this want, need, or desire, one of the things that happens is it's a different dynamic. I stopped talking about which lab I use and the occlusion and all these things that really don't matter to the patient. And I can go back to that. When I talk about symptoms of cancellations and no-shoes, I go back to that. So if I keep that emotional piece, that desire, okay, let me just remind you, Amal, when we first started working with you, you shared that you wanted this to happen before your daughter's wedding.
Right.
And so in order for us to give you what you said you wanted, which was for this to happen before your daughter's wedding, I'm going to need you to keep this appointment that you made. It's so big, but people miss that piece, and it's the missing piece.
And it goes back to, again, converting data into intelligence.
That's exactly right.
If you have just used those as words, filler words, and you haven't taken that data into intelligence, that's exactly all day long at Patient Prism. We're taking the words people say, and how do we convert that into something that a patient will change behavior based on?
Sure.
And if you cannot do that, and I think that's the theme of your talk today.
It really is.
How do you make insight from these words that are spoken between the patient and our team?
Well, what we know is, and as a speaker, as a certified professional speaker, what I know is there are a lot of speakers that have knowledge, a lot. But what we know is execution trumps knowledge.
All day
so
long.
For me, it's not about that I can get on stage and get them really excited and want to learn this. What I had to do was find a way to execute it.
Ideas are free, and it's all about execution.
It is. It really is. It really is.
Great conversation. Thank you so much.
Thank you for having me.